We're going to cover the chest in this lecture. Generally, when you look at the chest, using the axial CT images with IV contrast will give you the best differentiation between the vessels and other structures that do not enhance, such as nodes and the esophagus and that sort of thing. You'll also be able to differentiate the air in the trachea and into the bronchi. The MRI images may demonstrate bright or dark blood. It depends on what kind of imaging sequence you're using. When you're looking at the second edition of the Imaging Atlas of Human Anatomy by Weir, there won't be any IV contrast, and so it's really hard to distinguish the vasculature from the other anatomy. So if you don't have a later version, you might want to try to get your hands on one just to be able to see the differentiation and the better contrast. In both, you'll be able to see the lung windows and the bronchi really well. And when you're looking at them, the MRIs will show black blood. The MRI T1 weighted images will show black blood. So when you're trying to distinguish what you're looking at, take a look and see if you can tell whether it's a CT or an MRI scan. Look for the white bone for the CT images. And if it's not white bone, it may be an MR. You might be looking at a different type of window in the CT image. But take a look at that first, and then try to decide whether it's a CT or MR, and then take a look at the blood and the airways, and see if you can distinguish what kind of imaging sequence it might be, and then try to take a look a little bit more deeper to look at your anatomy, and distinguish each piece from one another. The third edition of the Weir book will have more advanced MRI images as well. And below is a list of the anatomy here that we're going to be studying during this lecture. So in taking a look at the mediastinum, it is that general area between the lungs, and that will include the great vessels, the trachea, the heart, the esophagus. And when we're taking a look at the borders of the mediastinum, it is generally protected by the sternum anteriorly and the spine posteriorly, and the inferior border is a diaphragm, and the superior border is a clavicle, first rib, that area superiorly. And we'll take a look at that in a lateral view in a little bit more detail in a later slide. But just know that it's that general area between the lungs and between the spine posteriorly and the sternum anteriorly. These sagittal views give you a good idea of the different areas of the mediastinum. There are different sections. So the superior mediastinum runs from the first rib, and you can see the T1 vertebra here, and then the sternal notch here. And this is the superior border of the superior mediastinum, and then the inferior border of the superior mediastinum is the sternal angle here, and then you go posteriorly from there in a general straight line to give you the superior mediastinum. The inferior mediastinum runs from the sternal angle at the top down past the xiphoid process by just a little bit here, and then follows the angle of the diaphragm, and you can see that here in this image, the angle of the diaphragm. And this is the inferior mediastinum. There's also an anterior, a middle, and a posterior mediastinum. So these are just general areas that are good to be aware of, but they're not something that you will find on any of the tests in this class. Once again, we can talk about the protection of the mediastinum by the bony framework, the sternum in the front, and the spine along the posterior wall, the ribs, and this first rib is the superior border, and the diaphragm at the bottom is the inferior border of the mediastinum. The esophagus is also contained within the mediastinum, but it runs from the oral cavity all the way down to the junction of the stomach here. And it generally follows anterior to the spine. So you can see here, this is the spine, this is the posterior side of the patient and the anterior side of the patient, and right and left. This is the spine and this is the esophagus, and occasionally you'll find air in the esophagus, which helps you to distinguish it from other anatomies such as nodes or vessels when there's no contrast in here. But if you can't see the esophagus, sometimes a radiologist will ask you to give the patient oral contrast, and it's not the thin oral contrast that you would receive when imaging the stomach or the intestines, but it's a thicker contrast that helps to coat the esophagus so that you can see it more clearly when doing the CT images or when viewing the CT images. And so the esophagus is anterior to the spine, and the trachea is anterior to the esophagus. And there are some flow to the esophagus and the trachea as they follow down inferiorly in the body, and they will not always stay in this position as you go inferiorly, but the general position is spine posterior, then esophagus anterior to that, and trachea anterior to the esophagus. And here's a nice image of it here. The esophagus is following down anterior to the spine, which we can't really see. That you may be seeing a little bit of it here, just on the right edge of the esophagus. And then anterior to the esophagus is the trachea here, this white bony structure. And when we study a little bit further the pulmonary vessels bifurcate at the same level as the trachea. So this is a tracheal bifurcation here, which we'll study in the next couple of slides, and the aortic arch. And the pulmonary trunk comes up just about here underneath the arch and bifurcates as well. So you'll see the trachea and the pulmonary trunk bifurcated about the same place. The trachea extends from the larynx to the bifurcation into the bronchial tubes, and bifurcation just means splitting from one into two. So here you have the trachea coming down and bifurcating or splitting into two at the level of the carina, and the carina is the actual bifurcation when it splits into two. Now the trachea is made up of a soft tissue interior, and you can see that that's made up of lymph vessels and arteries, glands, epithelium, and muscle. There's esophageal muscle and then trachealis smooth muscle, and then that is all protected by cartilage rings, and those cartilage rings help to protect that airway as it goes down. Here we can see a CT, and this is imaged in a lung window, so you change it so that you can see the lungs and the airway. So here's the carina here, it's just splitting into two, and then you can see the lungs as well, and these bright areas here are going to be vessels, whereas the black is going to be lungs and different airways. So you get some smaller bronchial tubes here, right there and there. And in high resolution CTs, we'll also be able to see some of the fissures within the lungs, and we'll see that a little bit later on in the lecture. This plate in Netter shows the relationship of the anatomy well. So you have the trachea here in white, and the aorta and the aortic arch is just to the left of the trachea and of the carina. So you'll see the on axial CT image, you'll see the aortic arch, and then just to the right of that, you'll see the trachea and the carina. And then, as we mentioned, the carina bifurcates at the same level as the pulmonary trunk. So here's the pulmonary trunk here, just inferior to the aortic arch, and it bifurcates at the same level as the carina. You can see the trachea coming down here, and the bifurcation just behind the pulmonary bifurcation. So you have the aortic arch, and then the pulmonary trunk bifurcating, and then the trachea posterior to that bifurcating at the same level. So that's the carina just posterior to the pulmonary trunk. And here it is on a CT image. So here is the aortic arch, and as we said, just to the right of that is the trachea, and if we were down a little bit lower, you would see the ascending aorta and the descending aorta, and then you would see the trachea bifurcate when you no longer see the arch. Here's the superior vena cava here. So you have the spine posterior, anterior to that is the aortic arch, the esophagus is in here, and then you have the trachea anterior to the esophagus. Now this is a posterior view, so I don't want you to be confused. This picture from eAnatomy here states that it's a posterior view, and you can see that the aorta is here, so this is the descending aorta here. And just to the right of that, because now we're going to the right since this is a posterior view, the esophagus is here. And just to the right and anterior of the esophagus is the trachea, the white structure here. And just where it bifurcates into the right and left bronchi, then this is the carina. And then you have the left and right pulmonary arteries here in the blue. This structure, or this picture here on the left, is from Netters, and Netters has pulled away the lungs so that you're able to see the heart and the great vessels more clearly. And it's just another example of the relationship between the aortic arch here in red and the pulmonary trunk, and how the pulmonary trunk and the left and right pulmonary arteries, where the trunk bifurcates into the left and right pulmonary arteries, just inferior to the aortic arch. This top image is a coronal reconstruction CT, and it allows you to see very well the trachea and the bifurcation at the carina into the left and the right main bronchus. And in an MRI T1 weighted image, it's very difficult to distinguish the black air from the black blood. And so in CT, it's nice to have the contrast in the vessels so that you're able to see the veins and the arteries versus the air in the trachea and the carina and the bronchus. So this is the trachea, the carina, left and right main bronchus. This is the aortic arch. This is the pulmonary trunk and bifurcation into the left pulmonary artery. And down here you can see the trachea again, the left and right main bronchus, the pulmonary trunk branching into the left and the right pulmonary arteries. The left pulmonary artery runs superior and then posterior to the left main bronchus. So you can see it running superior to the bronchus and then posterior to it here as it runs anteriorly. And on the right, it runs superior and then anterior for quite a ways. It eventually does wrap around, but it's after it has already bifurcated into other branches here, so it's not really the main bronchus at that point anymore. It runs superior, anteriorly, and then a little superior again before it starts to bifurcate into the other branches. So these two CT images are taken sequentially, and this one is a little bit more superior, and this one is a slice just below that. This is the anterior side of the patient, posterior side, right and left, same with this image. And we're at the level of the pulmonary artery bifurcation here. So we've got the ascending aorta, and if you were up higher you would have the arch, and this is the descending aorta. And this is the pulmonary artery bifurcation, so you've got the left pulmonary artery and the right pulmonary artery, superior vena cava here. And as we mentioned, the left pulmonary artery runs superior to the left main bronchus. So left main bronchus is here, and that artery is going just over the top of it. And then in this slice here, you can see how the left pulmonary artery came posterior to that left bronchus. So it runs superior and then posterior to the left main bronchus. And then on the right side, the right pulmonary artery runs superior and then anterior to the right bronchus. So here's the right pulmonary artery running superior to the bronchus and then anterior of it here. And it's still running anterior of it in this image as well. And so we are well past the carina because we have the two bronchi in both images. And once again, we have the spine here, the descending aorta, the ascending aorta, pulmonary artery bifurcation, right and left pulmonary arteries. And as we mentioned, the right bronchus is more vertical than the left, and it is the bronchus where the carina bifurcates is about the same level as a pulmonary artery bifurcation. They can be just a little bit slightly different from one another, but they're about that same level, so it's good when you're looking at the pulmonary artery bifurcation, or when you see the two bronchus instead of the single, then you will, or the bronchi instead of two bronchus, then you will see the pulmonary artery bifurcation very close by. In taking a look at the lungs, we have two lungs, a left lung and a right lung, and each lung is divided by fissures. The left lung is smaller than the right, as there is space needed in the left side of the chest for the heart. So you have a superior and an inferior lobe of the left lung, and it's divided by this fissure here. And on the right, we have a superior, middle, and inferior lobe of the right lung, also divided by fissures. This inferior lobe looks very small on this image, but when you look at them from the medial or lateral aspect, as we will in the next slide or two, you'll see that that lobe is not quite that small. It's just in the front anterior portion. It looks small, and it is small anteriorly, but as you go posteriorly, it's much larger. So just be aware that there are 3 lobes to the right, 2 lobes to the left, and that they are divided by fissures. In this image from Netters, they have sliced away the anterior portion of the lung so that you're able to see the trachea as it comes down and bifurcates into the left and right main bronchus. And the main bronchus and pulmonary arteries and veins enter and exit the hyla of the lungs, and hyla is plural. And hilus is an older term, and hilum is a more current term that they use for the entrance and the exit of the bronchus, pulmonary arteries, and veins as they move in and out of the lungs. And I apologize that my files don't seem to be syncing, so I had a more current version of this study guide where I put that hyla is the plural version, and some of the page numbers for these plates. It will be on the study guide, it's just not in the lecture, and I'm sorry for that. But there are lots of nodes, as you can see, that run along the trachea and as it bifurcates into the bronchi. And we'll see a medial view of this hyla here, or hilum, on this side, and we'll actually see both pictures. We'll see the right and the left lung in the slides to come. You can see the fissures here as they separate the lobes of the right lung and the lobe of the left lung. And here you can see the superior and inferior lobe of the left lung, and the middle and the inferior lobe of the right lung. And there is a fissure. On the high resolution CTs, you can often see the fissures very well. This is just a little portion of the fissure here, of the oblique fissure of the left lung. This is a medial view of both lungs. The left lung is at the top and the right lung is at the bottom. And you can see the hilum, where the entrance and exit point is of the bronchi, arteries, and veins. So this is the left main bronchus here, and the left pulmonary artery, and the left pulmonary veins. There's a superior and an inferior left pulmonary vein. And then over here is the right main bronchus, and the right pulmonary arteries, and the right superior pulmonary veins, and the right inferior pulmonary veins. And here are some bronchial lymph nodes as well. There's a couple of lymph nodes in this image as well. And you can see where the heart would take up space here in the left lung. Much more prominent, much larger space than over here on the right. And the 3 lobes of the right lung and the 2 lobes of the left lung. These are 2 images from eAnatomy showing you the pleura, which is a lining of the lungs. And you can see here on this bottom image, this is a posterior view, so you have the trachea here, the aortic arch, and the right pulmonary artery, the esophagus. And you can see the lungs on either side and how they are coated or sort of encapsulated by this pleura. But as well as being on the outside and wrapped around the pleura, or wrapped around the lungs, you can also see how the pleura goes within each fissure as well. So the pleura covers all around and even around the heart. Outside of the heart, you have some of this pleura lining. The thymus is made up of lymph tissue, and it is something that develops when we're in the womb and in infancy and early childhood. It's still within our bodies, but it tends to dissipate as we grow older. And as it goes away, it changes into fat, so it gets darker on a CT image. Normally, if you were to look at an image of a small child or an infant, you would see a much larger mass here. It would look much more the density of say, a vascular structure. But when it starts to dissipate in adulthood, it becomes fatty and it becomes much darker. So you can see where it's starting to take on the coloring of the fat here on the exterior part of the body. So this is the thymus here. It sits anterior of the aortic arch and the pulmonary trunk. So this is the pulmonary trunk here. This is a great view too of the main bronchus, the right and left main bronchus. So it's just at the carina where they have not split into two yet. So that's a beautiful picture of that. The esophagus here posterior to the trachea, and the spine posterior to the esophagus. You have the ascending aorta and the descending aorta. Again, the pulmonary trunk as it's just beginning to bifurcate, and then the thymus is here in the front. And this is another view of it anteriorly from E-anatomy. And again, you can see that it sits just anterior of the aortic arch, that's sitting back here, and anterior of the pulmonary trunk, which we can't see well in this picture. Lymph nodes. As you may remember from the previous lecture on the spleen and lymph nodes are everywhere. And you remember this picture from that lecture where you can see the various groupings of nodes and how they tend to congregate in certain areas, but they are all throughout the body, everywhere. And then this image here where we were studying the hyla of the lungs, and you can see the lymph nodes here, especially the ones in this area that we are studying in the chest. They are everywhere. You won't be asked to identify them for this class. They're difficult to distinguish between nodes, vessels, or an airway sometimes. And so if you can't distinguish it as a vessel or an airway, it's probably a node. They sometimes do enlarge. On rare instances, they will enhance, but it's unusual for them to enhance. Some of the major bundles in the area that we are studying now are the lungs, the esophageal, and the mammary bundles. And a review of the basic bony anatomy that surrounds the chest. The bony anatomy is a protector for the organs within the chest, the lungs and the heart, esophagus and the airways. And it also helps to provide structure as well for some of the rest of the body, helping to move the arms and that sort of thing. So we have the sternum. We'll start with that. The sternum is here, this whole piece, and this is the manubrium, and this is a jugular notch here at the top, and the angle of the manubrium here at the bottom. And this is the body of the sternum and the xiphoid process. And the sternum connects to the clavicle here, and it's called the sternoclavicular joint, and it is where these two bones articulate near one another. And then the clavicle goes laterally to attach to the acromion process of the scapula, and this is a acromioclavicular articulation here, and that helps to support the clavicle and the clavicle and the scapula. And then you have the scapula here on the posterior side of the body, and in the study guide I do have the plate number so that you can see the posterior view of this image as well. So then each rib attaches to the sternum at a different point, except for the two ribs here at the bottom, the floating ribs number 11 and 12. Every other rib connects to the sternum at some point along the way. Those floating ribs can be a little bit fragile, so you have to be more careful with those than the others. Each one of them can break or crack or bruise, but those ones tend to be a little bit more fragile than the rest. Looking at this on a CT image, we have the posterior side of the patient here, anterior, right and left. You can see the scapula on the posterior side of the patient here, and the spine, and how the ribs articulate in the back with the spine. And as they come around, you're seeing pieces of different ribs here as they come around and articulate with the sternum or attach to the sternum here through some cartilage. Those are called costal cartilages here in the front. As you can see in this blue, that's costal cartilage. And this is a manubrium here, so we're up at about this level here on the first and second rib. And this is the sternoclavicular articulation here, so there's a clavicle. as it comes across the joint. If you were superior in the body, you would see this clavicle as it comes across, and you might even see the sternoclavicular, acromioclavicular articulation out here as a chromium process comes across from the scapula and attaches to the clavicle. But we're inferior to that, so you see the humeral head here and the coracoid process of the of the scapula. And there you can see it right here, the coracoid process, where the humeral head rests against the scapula. And that is our review of the bony anatomy that surrounds the chest and the end of our lecture for this week. Thank you.